Dr. Ndidiamaka Amutah-Onukagha, thank you so much for coming on the Further Forward podcast.
Thank you for having me. I'm thrilled to be here.
I'm so happy to have you. For people who do not know, we were trying to get connected over Lululemon stuff back in like 2021,
Yes.
but you were about to have a baby, so we didn't quite get there. Now you're 3 kids in, I'm 1 kid in, and I am just, this is just the perfect example of like what's meant to happen is going to happen.
Always happens when it's supposed to. Yep. Thank you for having me.
All right, I start the podcast the same way every time, every guest, no matter what, because I don't read anyone's bio because people can do that on your own. You know what I'm saying? And it's weird sitting there while somebody's reading everything.
It's very awkward, and mine is like 10 pages long. So
yours is 10 pages long because you're amazing. But in your own words, who are you and how are you?
Thank you for the question. That's such a deep, thoughtful question. Who am I? I am the daughter of Nigerian immigrants. My parents are Igbo. I consider myself Nigerian American by way of Trenton, New Jersey. So you got a bit of Jersey, you got a bit of Niger. So I'm sitting at that intersection, right? And so depending on the time of day, you're going to get both. You're going to get the Nigerian, you're going to get the Trenton. I am the eldest daughter. And so in my culture, the eldest daughter is Adane. So it's a position of privilege in a family, my birth order. So I am the protector. I'm the overseer of the familial business. I'm the eldest daughter. I am a mother. I have 3 beautiful children. I'm a wife. We just celebrated our 10-year anniversary last week. So depending on when this airs, April 2026. And I'm a boss. I'm a boss, right? Like in every sense of the word. And, not only professionally, I run a research center on women's health and maternal health. I have a consulting company with over 100 contractors. I just, I'm a leader. And I'm the type of leader that leads by example. Like I try to model very healthy behaviors from my team, from my family, from myself. I do believe that you can have it all. I feel like I'm somebody that has it all. I have a healthy, stable, wonderful husband. I have 3 beautiful children. I have a thriving career. I'm an entrepreneur. That's kind of having it all. But there's a method to having it all. And I'm someone who's very grateful. So, how am I? I'm a person that leads with gratitude, with grace for what God has blessed me with, and with a vision for the future. I have a healthy appetite for success. And I don't really understand what no means. My brain cannot really decipher no when it comes in. My brain kind of filters it back out. So we don't really understand no. We don't really understand what that looks like because I believe there's a way. When you have a will, there's a way. And I also believe that God meets you at your level of faith. So if you think you can do what you can, and if He meets you right where you are. If you say, God, this is for me, it will be for you. The life that I'm living now, I have manifested it. I had a vision board with the kids and the husband and the being on the beach and like just all these things that you see for yourself. Everything on that vision board has come to pass because I live life with gratitude, intention, super clear, but also from a heart of submission to God's will. And that's how I ended up in Boston. I never saw myself being in Massachusetts at all. But the position came up. I know.
Same.
I know.
Same. Because I'm from Jersey too, right?
I didn't know you're from Jersey.
Yeah, I'm from South Jersey. See, this is why I love you so much.
Yeah, exactly. We're already here. Jersey vibes.
Already. Yeah, I didn't see myself living here either.
I was like, here we are for a year and we'll be back in Jersey. And that was 10 years ago. I'm on the PTA. It's like, okay, I guess I live here now. Like I'm volunteering at the school dance tomorrow. I was like, oh my gosh, I'm back. Wow.
You're really here. You're really here where you live. Yes.
Exactly. So that's who I am and that's how I am.
Thank you for that. Oh my goodness. You saying I'm a boss is going to live in my head forever.
Yes, absolutely.
This was not on my list of questions, but like I have to go there because you said it.
Yes.
You can have it all.
You can.
Yes. Believe it. I fully do.
Yes.
some women that I admire, like certain celebrity women, have said, like, you can have it all, just not at the same time. Agree or disagree? What do you think?
I agree, but you have for you to have had it all at the same time now, the foundational blocks had to have been laid a long time ago. The life that I'm living now, I manifested it over a decade ago, right? So when I was in my 20s and my friends are like traveling, doing what young people do, I'm in school, right? Like I finished my PhD by the time I was 29 because I in my mind I was like, by the time you're 30, you're an adult. And so I was like, I want to get school out the way. So I pushed through my master's, I pushed through my PhD because I knew I wanted to be in my soft life by my 40s, right? So the
Okay.
40s that I'm in now, I manifested it 10, 15 years ago. I was like, listen, I can't take that trip. I can't come to this. I can't come to that. I got to finish this school because as we know, like for women, we're on a clock. We're on a different clock than men, right? Like
Yes.
we're on a biological clock, we're on a career clock, we're on an ovulation clock. And so I wanted to be able to lean into my mothering journey. I know I always wanted kids, but I didn't want to be like stressed about it, right? So I did all the foundational work for this life 10, 15 years ago. So yes, you can have it all now, but you got to start then. That's the trick to it. That's the part of the conversation, right? Like I'm preparing for retirement in the future. I still have another 15, 20 years of work, but I'm already preparing for retirement. What is that going to look like financially? And what's the infrastructure that I need to be retired? So that when I get to retirement, I can travel and spend time with my kids and my grandkids 20 years from now.
Right. Right. Okay. I'm
Yeah.
taking that away.
Yeah.
It's about intention, it's about planning. And
Yes.
then what I'm also hearing, the thing behind the thing is that it's about boundaries too, because you're gonna have to say no to some things in order to say yes to other things.
So you
So it's like, what's more important?
the ROI. There
Yes.
the term short-term pain for long-term gain, that's what it is. So the life that I have now gives me the freedom, the autonomy, the flexibility to show up for people fully. So I might have missed your 25th birthday dinner, but if you're having surgery or your mother dies, I can come and stay with you for a week. You see what I'm saying? Like so I try to really think about the longevity. I remember one of my best friends said this to me when I was moving. I was like, oh my gosh, like our friend group is gonna break up. And he was like, Didi, we're your best friends. We'll go with you wherever you go in life, right? Because good relationships are not tied to geographic boundaries or time. They're tied to the depth and the quality of the relationship. So once you kind of move with that energy and you set yourself up, it gives you the fluidity to be able to show up for people in a more intentional way. But yeah, you're gonna miss some stuff. There's definitely it comes at a cost when you're building. There's nothing in life that's worth having you're not going to have to work for. You want a healthy marriage, you have to continue to date your spouse. You want to be a multimillionaire, you're going to have businesses, not a job, right? Like there's nothing that you're going to have that you're not going to have to put in that sweat equity. But I promise you, there's no level of success that is achieved without hard. There's no shortcut. There's no there. If there was, people would have done it a long time. There is no shortcut to success. It's the late nights, it's the early mornings, it's the grind. When the kids go to bed, you pull out the laptop, you get up an hour early to go to the gym. Like there has to be a semblance of order, structure to plan and preparation. You're not going to wake up and be successful. You're not going to wake up and have more time. You have to create the infrastructure for those things to be able to.
Exactly,
Yeah.
exactly.
Yeah.
Yes, yes. I'm in the
Yeah.
midst of that.
I received that
I
for you.
I've noticed that it has changed. Like, I think where I've been a little bit slower is that, uh like, I'm not great at moving with the season of life per se. I'm like, "But this worked then. I
Yeah.
want it to work now. I
Yeah.
already set it up. I already
Yeah.
had it."
Yeah. Yeah.
And it's just, even just the last 5 years of my life with Zion, what I'm able to do now versus the infant phase, right? I'm a whole new person, and so for me, I'm like, "Okay, bitch, like, move on,
You
move on,
know,
move on."
this is gonna help you. I don't know who said it, but there's no growth in the comfort zone, and there's no
Yes.
comfort in the growth zone.
Ooh, and there's
Yes.
no comfort in the growth
So if you're
zone.
sitting
Yes.
in a place of comfort, you're not growing. There's inherent in your growth is an underlying layer of discomfort. Something is uncomfortable, right? You're gonna miss time with somebody. You're gonna have to get up early. You're gonna have to cut this event short. There's an under the underlying layer for success is discomfort because you're growing, you're shedding. You're growing and shedding, and that's uncomfortable. Nobody wakes up with six pack abs. You got to go to the gym, honey. You think those Peloton instructors
Amen.
that I watch every week, they in that gym every day. Okay, so there's a layer of discomfort is built into your growth and success. If you're comfortable, everything's moving smoothly, you're not growing. You're
Yeah,
comfortable, but you're not
you're comfortable,
growing.
but you're not growing.
Yeah,
Yeah.
yeah.
If you ever wanted to leave maternal health, you could be a really amazing motivational speaker,
I
my
wish
friend.
if I had a dollar for every time, I wouldn't even be in maternal health. Because you know what it is? I not only am I a motivational speaker, I have saved 5 marriages.
What?
5, 6, yes. Because other high-powered women like myself, we get to these places and then we start to give the job more than we give the home, right?
Right.
And so what helps me is to think about my life in buckets. Like what my kids need as their mother is different than what my husband needs as his wife, is different than what my job needs. And that the bucket mentality has worked for me because you're constantly vacillating between these worlds. And guess what? Your kids don't care about your meeting. And your
They
husband
sure
doesn't
don't.
care about your meeting. And your husband doesn't care that the kids sprained their knee. He needs his wife. Right. And so you kind of have to constantly shift. What does this moment need? It's not what the other moments needed, right? And so that bucket has helped me a lot. When I think about my day and my life in buckets, I'm able to show up fully for whatever I'm doing at that moment. People always say, I know you are the hardest working woman I know. When I'm with you, I feel like I have your full attention. I'm like, you do have my full attention because this is your bucket. This is your
Right.
bucket. There's no
Right.
overlap in your bucket.
That's
You see what
so
Isn't that right?
yes. It's also like it's giving mindfulness
Yes,
too,
yes,
which
yes.
is like on the surface you wouldn't think that, but I'm like, no, that's just extreme presence
Extreme,
and self-awareness. I love
right?
it. Oh my
Right?
gosh.
I'm
Oh
gonna
my
write.
gosh.
I'm gonna write a book on leadership. I have a
Please
book
do.
in me. I have a book in me.
You do.
I have a book in me. I need to just sit and voice note it because everybody wants to be a leader until it's time to lead. Right? People. That's the title. Everybody wants to be a leader until it's time to lead. You think this is easy? You think it's fun? There's mechanics and a science behind it to executing it seamlessly. And then you have to plan for contingency. The kid gets sick. Somebody does this. You can't control things. One of the strongest parts about leadership is controlling what you can and preparing for what you can't. What are the things in my ecosystem that I can prepare for? This is Teacher Appreciation Week. Okay, who's going to help me with that? Is it Amazon? Is it who's getting me gifts for the kids? For that's what I can control, right? Now
Right.
the kids getting sick, I can't control that. So how do you prepare and take care of what's in your ecosystem with the contingency for the things that are not? That's what knocks people down. You don't have a plan for the unknown. The unknown comes and now you're on your ass, right? Because you didn't
Right.
see it coming. You also didn't have a plan for when it comes. My husband always says this. Shout out to my husband. He always says, you can't train for war on the battlefield. Isn't that so good? You can't. You can't. By the time the war is here, it's too late. You got to train behind the system when things are calm. You can't train for war on a battlefield. And that's like my premise in life, right? Always being prepared. Now, listen, I'm not perfect, honey. I dropped the ball.
You kind of
Let
are though.
your
You kind of.
listeners know I am a human being. I drop the ball a lot. Okay. But I take accountability when I do. And am comfortable like having I think early in my mothering journey, I was like, I gotta do everything by myself. I'm a mom, these are my kids. And now I'm like, can you pick him up through school? Thanks. Can you now I'm like, it's a team.
Right. It's a team.
A team. You gotta let
Mhm.
go of that need for control, honey, because you'll burn yourself out. And then you can't show up for your buckets. You can't show up for your buckets, right? Because now 10 o'clock at night, your husband wants to watch a movie. You're cranky and overstimulated and you want to go to bed. So you miss that window, the 1 hour you get with your spouse a day.
Yep.
Miss it because you didn't prepare for the bucket.
Right. Wow.
I'm telling you.
Wait, so it's also making me think quite literally about what you do and
Yeah.
Black maternal health. And there is racism, obviously,
Mhm. A lot.
and there is the stuff in our bodies that we can't control.
Yes.
And then there are the stressors that I want to be careful when I say this, but maybe the things that are in our control that we
Mhm.
allow
Mhm.
to
Mhm.
swirl and get
Mhm.
bigger and stuff like that.
Mhm.
And so when you are working How do you think about those 3 things? How do this might be mother lab work or maybe it's in your research, but when you're talking to folks,
Yeah. How
what
do
do
you
we
extend
do?
the intersection? So, a couple things. One, we have to acknowledge that racism is baked into our healthcare system. If you are a consumer of the healthcare system, you will, and you're a person of color, you're differently abled, English is your second language, whatever you got going on, you will inherently be met with racism. It's a natural part of our healthcare system. It doesn't have to be like that, but it's baked into it. It's embedded in the way that clinicians are trained, in the way that clinicians run their practice, in the way that policies are written and executed, in the way they write about you in your hospital notes. It's in every facet of our healthcare system, right? So that's the first thing is that a clear acknowledgement that you're walking into a contentious space. If you're a person of color, if you're a black woman giving birth, you're walking into a space of contention. So that's the first thing is an acknowledgement. The second thing is meeting people where they are. I think that a lot of times there are things in our body, our physiologic response to stress, right, is based on cortisol. We know that Black women have higher levels of cortisol. Our bodies are weathered by the physiologic responses to stress. So we have higher rates of blood pressure, we have higher cortisol levels. We inherently manage stress in our bodies differently. Black women are 5 to 7 years older reproductively than our white counterparts.
What?
Yes, 5 to 7 years. Yes,
5 to s
yes.
5 to 7 years?
Yes, we have shorter telomeres, we have higher blood pressure. That is why Black women are more likely to have preterm birth, low birth weight, small for gestational age, intrauterine growth restriction. All these pregnancy complications, preeclampsia, eclampsia, are hypertensive in nature or cardiovascular in nature, and they're built from the way that our bodies handle stress for being Black in America, Black in our bodies, Black in a global diaspora. So those are the things that we need to acknowledge, right? The things that we can do to kind of close the gap, remediate, ameliorate is to arm ourselves with the best possible teams, which is your social support, your given family, your natural family, but doulas and midwives. The midwifery model of care is saving lives. We know midwives save lives, right? Like, and so the midwifery model for care is vastly different than the obstetric model. The midwifery model is family oriented, holistic. It prioritizes the birthing person and the type of experience they want to have. We know that doulas are angels on earth. Right? I've had 3 doulas, incredible with all 3 of my births, amazing. And I could not see myself birthing without a doula. And so, like, we have to kind of arm ourselves when we go into these spaces, whether it's a home birth, a hospital birth, wherever you're delivering, you need a team that ideally consists of a midwife and a doula. This is what Black women and birthing people can do to try to ameliorate some of the impact of racism that they will experience. Yeah, it's a lot. It's a
It
lot.
is it's
It's a lot.
it is a lot. I had preeclampsia and I work in wellness. I meditated through my pregnancy, did all of the things, and my blood pressure still crept up, and I was lucky, but, like, it was boom, 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 I was taken care of. I had a nurse come to my house for weeks
Perfect.
after
Yes,
just to
absolutely.
take my blood pressure,
Same.
whole thing.
Yeah.
I had a blood pressure cuff at home, I was
Yes.
checking it at
Same.
home, like my husband, the whole thing, and still,
Yeah.
that's what blows my mind, and I'm a Capricorn, I'm the oldest daughter, I'm a Jersey girl. My brain automatically goes to,
Solutions.
why aren't we fixing, like,
I know. I know.
there has to be something I'm missing. Sometimes I'm thinking, like, it can't be this difficult for this long of a time. So many Black women dying. It's terrifying. It makes you almost not
Absolutely
wanna
terrible.
have kids.
200%. I get emails, DMs every day. Hi, thank you for your work. I'm pregnant or I'm trying to get pregnant. I'm scared. What resources can you? I get these all the time. What I tell people is that we have to think about birth from a place of joy. And the Shira Burrell talks about this often. Neighborhood Birth Center. We're opening
Yeah.
the first Black birthing center in
Yes, we
Massachusetts.
are.
In Roxbury, honey, I'm so excited. I'm on the board. And the Shira often talks about this. How do we reframe the birthing experience from a place of joy? When you move from a place of joy and holding these systems accountable, there's a physiologic response in your body and you kind of like are able to relax. We go in so hyper vigilant because we know that we're going to be met with some nonsense. We have to reclaim it for joy. joy. And that's one of the premises of my center. So, my Center for Maternal Health Advancement, our mission and vision is to protect the Black birthing experience while creating spaces of equity for people. Right. And so you're thinking about women's health across the lifespan. How do we hold space for equity from menstruation all the way through menopause? We deserve equitable outcomes. We deserve equitable care, treatment, access, and we deserve to have joy. Whether you are 13 years old and you're menstruating or you're 55 and you're perimenopausal, we deserve joy in our experiences. And so that's how I talk to women and talk to communities and talk to providers and talk to nurses and say, listen, your job in the maternal health ecosystem is create safety and joy. People should come out better than what they went in when they left your care. If they haven't, you failed them. You failed them. You failed at your jobs. It's reframing it from like crisis and disparities, and Black women are 3 to 4 times more likely to die. And we have the best solutions. We know what to do. People are like, what can I do? What do I do? I'm like, you see your patients as you would see yourself. If this was your cousin on this table or your sister or your aunt, what would you do differently? You'd be checking their blood pressure, right? You'd be monitoring their hemorrhage, right? You'd be making sure that they were comfortable and that their pain was properly medicated and treated, right? You treat your patient like you would treat somebody that you care about in your family. That's all we need to do to fix the healthcare system. It's not the technology. It's not intervention. We know the solutions. We have the solutions. Maternal safety bundles, hospital protocols, quality improvement measures. We have all the data we need. All we need people to do, from the nurse to triage, the L&D clinician, the postpartum, treat this patient as you would treat a family member. This is your sister on this table. This is your cousin on this table. What would you do? You'd give them the best care possible, right? You get every specialist in there. When that blood pressure starts surging, you're going to make sure that they're treated. When you see signs of preeclampsia, the swelling, the headaches, sensitivity to light, you're going to get them on their magnesium, right? You're not going to say, oh, we'll wait and see. Oh, that's what happens in pregnancy. No, the waiting and seeing is killing people every day. Every day. It's not hard what we need to do. Not difficult. Yeah.
Mm, mm.
Right?
Yeah. I mean, I'm pausing because it almost makes you more mad.
Yes.
Right?
We should be pissed off every day. That's the only
Right.
way we can change. If we're not pissed off enough, if we're not angry enough, we are not going to get the change that we deserve. We cannot go through life and manage our healthcare systems, our legislatures from a place of comfort. We have to be angry. We have to hold them accountable. These hospitals work for us. They're billing our insurance. Even if you're on mass health, even if you're on public insurance, they're still billing the hell out of them. Okay. And our legislatures, we put them in office. So now that you're in office, I need you to advocate and prioritize funding and resources for things that are helping your constituents. So, yes, we should be pissed off. Anger moves things along. If we are comfortable and we're not angry, it's going to be status quo. People will continue to die. Even clinicians are dying at hospitals that they work at. Now let that sit for a minute. Dr.
Makes
Shanice
no
Wild, may she
sense.
rest in peace. She was a pediatric resident at the same hospital she gave birth at. She worked there in Indiana. Dr. Shanice Wallace, and she died. Okay. The other one that happened at the top of this year in January, and my gosh, was it South Carolina?
Uh,
She was a nurse.
Janelle
Janelle.
Janelle Smith. Was it
Janelle
Smith?
Greensmith.
Greensmith. Yep.
Yes. She just worked at the hospital. She was a midwife, delivered over 200 babies. She's a midwife herself at the hospital she works at. This is literally what she's built her career on. She just got married, just got her DNP. She didn't even get to enjoy those things. She's like 6 months into her marriage. Could you imagine? So even in spaces that we are supposed to feel safe, these are my colleagues, we still have to be armed with the advocacy. I'm not comfortable with the way that you're talking to me right now. I'm going to need another nurse. I'm going to need another clinician. I'm going to need you to step out of my room. We own our birthing experience, even if it is in a hospital, right? And so you create the standard. But we have to be empowered to do that. We have to have the agency to do that. We have to feel safe to do that. And this is why we need doulas and midwives along this journey with us so they can check people for us as well.
Exactly.
Okay?
Exactly. Yeah.
You need a team.
Yeah.
You need a team as a birthing person. You're not just going in by yourself.
So what I'm hearing from you is that it's like multifaceted and you're holding multiple things, right? Like racism is real and you're allowed to be joyful. You're allowed to enjoy your pregnancy and you still need to be fighting for better.
Yes,
Even if you are not a birthing person of color, you should still be fighting and advocating and all the things. And it sounds overwhelming when you're trying to say, and you should do this and you should do this and you should do this, but it's also kind of like the rhythm of life is
yes,
that we enjoy and
yes.
we acknowledge what's hard and we fight for better and on it goes. We already know how to do this
We know
because
how
we do it in
everything you
other
need.
facets.
Yes, but everything you need is already within you. Everything you need is already within you. You don't need a degree, you don't need school, everything you need innately. This is why clinicians and providers need to listen to their patients. Everything we need is already within our bodies. We have all the skills we need to get through labor, to get through our pregnancy. We just need to be heard. We just need to be listened to. There's nothing else that we need. We have everything we need. We are the solution. We are the solution. And let me say one other thing, because I know some of your listeners may not be women of color. Listen, our maternal health infrastructure is failing all women. It's failing Black women. It's failing white women. It's failing Hispanic Latina sisters. It's failing American Indians. It's failing Alaskan Natives, Pacific Islanders. Our healthcare system is failing all women. It might be failing some more than others, but all of our rates are in the toilet. All of our numbers are abysmal. All of our numbers are embarrassing in a global context. We spend the most per capita on our healthcare expenditures. We should be number one with outcomes. We're not. So I just want to say that because sometimes people feel like if I'm not a Black woman, why do I care about this conversation? It's affecting you as well. You also are not getting the standard of care that you deserve. You're also having more unnecessary C-sections, more intervention, unnecessary complications. This is how the healthcare system runs. It's not, racist in that way. It's profit capitalism. Ev- they, everybody's getting fleeced. Everyone's getting fleeced. You know what I mean? Like, yes, you're more likely to get fleeced if you're a person of color, but everybody's getting fleeced. All of us are dealing with unnecessary complications and having to be adamant about not wanting a C-section and no, I don't need that epidural and no, I don't want that Pitocin. It's happening to all birthing people.
Thank you for saying that.
Mhm.
Mhm.
Yes, yes.
So I know we need to wrap this up, but I have 2 questions. What kind of world are you building?
Oh, that's a good one. I am building a world where my sons and my future daughter-in-laws and my daughter um, are able to enjoy the privilege of a country that sees them, a country that sees them, right? Like I need them to be seen. I'm raising Black boys in America. I need them to be seen, held. I'm raising a Black daughter in America. I need that softness and firmness to be preserved and acknowledged. And I need them to be able to get the care that they deserve in a country that spends as much as we spend. Right. And I also need them, frankly, to benefit from being second. They are, yeah, second generation immigrants. I need that benefit to come across to them. Their grandparents pay dues, their parents pay dues. I need them to sit in the fullness of what it means to be an American. This is ideally a democratic place where you can do what you need to do and put like that's the premise of America, at least it used to be, right? Right. And so that's the world that I'm building and I'm fighting for is a place of safety for them and a place where they are seen. They don't have to walk down the street with the hypervigilance that their parents and their grandparents had to do. They're able to walk down the street with the ease. I'm building a world of ease, right? The dues have already been paid generations ago. I need you to just sit in the blessing of being second gen. Just enjoy that, right?
I love
That's
it.
what I'm building,
Beautiful.
right?
Beautiful.
Thank
Yes.
you.
Please keep going so Zion can join that world.
Exactly. He's already there. Zion and Uchenna, that's his playmate, same age.
Love it.
Yes,
Let's go.
yes, let's go.
Oh my gosh. And the final question is there a piece of advice or something that you live by that you can give to us as a gift?
My piece of advice is to always, always bet on yourself. Always bet on yourself. Even if you don't have all the pieces, even if you don't know how this is going to play out, even if you're not 100% sure, when you make the decisions, you let yourself be your own compass, you will always come out on top. You don't let people influence you. You don't wait to have all the information. You go when you feel like it's ready to go. That also has like a spiritual component to it because I'm under the submission of God and He kind of pushes me and positions me and puts my name in rooms and puts me where He needs me to be. But when you trust yourself, that comes from self love. You trust yourself, you trust the decisions that you make, you operate from a space of discernment spiritually, and you bet on yourself. Even if you don't have all the answers, you don't have all the pieces, you don't know how this is going to work out, you try it. And if it doesn't work, who cares? You made the decision for yourself. You are the compass. You set the standard. You're the goalpost. There's no competition. Last thing I'll say is like, I never, ever, ever compare myself to anybody. Never. Never. There's no
Yes.
comparison. I'm one of one. I'm one of one. There's no comparison. Who are you going to find another first gen Nigerian American? Where's the competition? So why would I even do that? Oh, she has this and she's skinnier, or she has more money, or her kids are, I don't know, speaking 5 languages, whatever it is. There's no competition. I when I tell you I don't even pay attention to what other people are doing, I'm like, oh, you did that? Oh, that's what's up. Like I'm on my own lane. I'm all I need. Just me and my family, honey. I don't because comparison steals your joy and it minimizes your own accomplishments and it makes you feel like, well, why don't my kids speak 5 languages? My son is the same age as hers. Honey, you don't know what else she's sitting in or they're sitting in or you know what people got going on. All you see is a snippet of their life that they choose to share. You don't know that's the tip of the iceberg. So I never compare myself and I always trust myself. I hire from my gut. I make decisions with my gut. Everything I do comes from here because that's all I have at the end of the day. And then when I'm laying in the bed reflecting on my day, I'm thinking about the decisions I made with the information that I had. I don't lean on other people. I lean on Him, lean on God, and that's what the word says: lean out on your own understanding. But in all thy ways, make your petitions known to Him. That's the only person you really have at the end of the day. That's my spiritual belief. So I lean on myself, and I never compare myself to anybody. I don't pay attention to what other people are doing. If you tell me I'm happy for you, I will rejoice with you, I will cheer with you, but I never compare myself. There's a danger in that comparison.
Yeah, there is.
Dangerous.
There is. Damn. I mean, my neck is gonna snap from just nodding and being like, "Yes, this is a whole word right here." Thank you.
Thank you
Thank you,
for this
thank you.
opportunity. Your questions were so thoughtful. I hope we
Oh,
got
I
this
appreciate
around.
you.
Yes, good.
Thank
Oh, I
you.
appreciate you too.
I know this will not be the end of
Yes,
I
I do.
mean, the audience might not
Yes.
get to hang out with us, but
Right,
this
right,
won't be
right.
the end for you and I.
Yes. We're just getting started. We're just
We
getting
are. Thank you so much for this time. Where can people find you? Do you
Yeah,
want people to find you?
yes, I do. Okay. A couple places. So my center is our website is maternal health advancement.tufts.edu. My research lab is motherlab.org, just MOTHER lab.org. You can put my name in Google, Amutah Tufts, AMUTAH Tufts. Our LinkedIn is very active. Our Instagram is very active, Center for Maternal Health Advancement. And I respond to every email. I mean, it might take you like December to get on the calendar, but I respond to every email. So if anybody wants to follow up from your podcast, hi, I heard you on Ashley's podcast. I'd love to chat now. Okay. So I look forward to continuing the conversation with you and your listeners.
Yes, thank you. Thank you for being so
Thank
generous.
you. You're so
Okay,
welcome.
everybody, like listen to this episode, but also please send it to someone who you know needs this word, this testimony, this moment in time, this joy mixed with the seriousness of real life. Like we're doing it all. We're holding it all.
Oh,
Thank you for being here.
you are so welcome. Thank you for having me. I will come back on anytime. This was a pleasure. Yes,
Thank
yes,
you.
anytime.
All
Anytime.
right, bye everybody.
Thank you.